Andrew Holness, the Prime Minister of Jamaica, recognizes the need for individuals to take better care of their health. To develop a defense against non-communicable diseases, NCDs, he specifically wants Jamaicans to watch what they eat and engage in regular exercise. Moreover, the Prime Minister emphasizes that financial health is also essential, highlighting the significance of saving.
I do try, but I can't be honest to say that I've always been able to maintain it. Sometimes I do fall off. The schedule is just so hectic, especially when I travel, that I don't get a chance to maintain it. But I do make time for
what do you do?
I like running. I like running and cycling when I get an opportunity. But now I have to be careful. You don't want to damage the knees too much. So I might transition to more riding than running. Yeah.
What about diet?
Wow. So I've gone through all kinds of diets. I've done high protein diet. I've done intermittent fasting. By the way, which
have you heard of the lion diet?
No, I haven't heard. Which that's the high protein. That's meat.
Just meat.
Right. So I'm
on it.
I've done the high protein, and I've done intermittent fasting, and I've lost a lot of weight. And then I've slowly put it back on. I try to maintain my weight, at a good BMI. So yeah, I do try to manage it, but I can't tell you that I'm consistent.
What would you say to many Jamaicans about balancing all that with their financial well-being as well?
You have a trade-off between using your time to earn money and using your time for well-being. I think there is a fallacy that you're going to use your time to earn money and then you're going to use your money to get well-being. And I get trapped in that as well. My job is not about earning money. And I've never been driven by that. That's not what sparks me. So I do need to obviously take care of my family and my sons who are growing up to be their own persons now, adults, and to make sure that in the future that I can live comfortably. But just speaking generally for our public, for our people, the key is to save. The key is to save, regardless of how small your income is. You have to put aside something for the future, if not for yourself, but for your children. And I know the immediate retort is that my salary isn't enough and things are too expensive. But saving is about sacrifice. So you have to make a sacrifice that you're not going to consume all your income now. You're going to put aside something. And the same for your time, that you have to look about your physical well-being as well. So I know it's not necessarily a cultural thing for Jamaicans in terms of what we choose to eat and choose to exercise. And it is a sad reflection that our culture is one, in terms of what we eat, focuses on a very much a high starch diet, which predisposes to some of the non-communicable diseases which affects us, and not just high starch, but especially in our modern times with quick service and fast foods, that we also get high sugar consumption, particularly for our children. And that again predisposes us to certain NCDs. And then for many of us, we don't take exercise past a certain age as required. And we, by not exercising and by leading a sedentary lifestyle, meaning sitting down a lot and not moving a lot, we bring on to ourselves certain non-communicable diseases. So my advice would be to do everything in moderation. Clearly, if you don't drink and smoke, you're ahead of the game. I have never been a drinker or a smoker. If you make time for exercise, vigorous exercise, and building muscles, you should be developing some defense against the NCDs. And if you make a concerted effort to change your diet and to include vegetables and proper protein, you should again develop a defense against some of the non-communicable disease, the hypertension, the diabetes, and the other heart conditions and so forth that affects us. Yeah, so that would be my advice. I'm 51 this year. I think I'm in good shape. I try to maintain. It is a struggle. But we have to make the effort.
The Prime Minister, through his Ministry of Health and Wellness, has launched a campaign with the hashtag #KnowYourNumbers to assist Jamaicans in combating the growing problem of non-communicable diseases and premature mortality. His Health and Wellness Minister, Dr. Christopher Tufton, emphasized that the objective is to provide Jamaicans with current health information in order to inform lifestyle decisions such as what they consume, how much they move, and the need for routine health checks. Dr. Tufton stated that in 2020, 59% or close to 13,000 people died prematurely. That is, before their 75th birthday, according to the statistics. According to him, in 2020, NCD fatalities resulted in the loss of approximately 145,000 potential years of life, a 30% increase in potential years of life lost, or 34,000 additional years lost annually over a decade. The rate of increase for premature deaths due to NCDs was greater than for all other causes. 30% for NCDs versus 19% for all other causes, said Dr. Tufton. He also stated that the data indicate that more Jamaicans die of sudden and unexpected emergencies such as heart attacks and strokes or loss of limbs due to undiagnosed diabetes. He emphasized that the Know Your Numbers campaign is about educating people about their health status so that they can take preventative measures if they are prone to any illness. Welcome to Wellness Men Mastery, your go-to source for weekly financial, health, and wellness information. Subscribe now and stay updated with our helpful tips and advice.